First of all, very pleased to be here to join this HIV drug therapy in the Americas. This meeting is, I believe, offering a great opportunity to the region, and it's great to link up to previous experiences in other parts of the world. I would like to comment particularly on sort of the picture that has been emerging through different presentations throughout the first part of the conference, and insist a little bit on this concept of heterogeneity of the region that shows really coexistence of very and pretty different realities. A region that has been able to reach the highest levels of coverage, provision of services in low and mid-income countries, which is an undeniable success. A region that has been able to generate pockets of excellence with high-level, world-class research being implemented, but also a region that is still struggling with some of the basics, some of the fundamental problems that would allow maybe to complete a transition of the response to HIV from an emergency-driven phase, which goes back to the early 2000s, the years of the scale-up, into a new phase of more sustainable and more expandable response. I think there's still a number of challenges that have been pointed out in terms of late or insufficient access to diagnosis, persistence of kind of old-fashioned schemes, protocols, diagnostic algorithms, maybe deficiencies in models in terms of decentralization of services, making all services that are available and provided become more accessible where they're necessary. But also some structural problems like an excessive centralization of ARV services, a certain dependence on external funding, particularly in certain countries. Access to antiretroviral therapy is guaranteed, it's universal and free, but still we see that approximately 20% of patients see their antiretroviral drugs being purchased through external solidarity mechanisms, large funding mechanisms that come along with Global Fund, to make an example. So how to guarantee sustainability in this context is one of the big challenges, and we hope that the new guidelines that WHO is soon to be launched will offer a stronger normative backup to what we are collectively already doing in reality in the region. And this is part of the good news. Most of those barriers, I did mention only some, including the access to testing, the fragmentation of the ARV armamentarium into an unnecessarily high and large number of treatment regimens, and then certainly big question marks like impact, low impact or low visible impact on mortality, and then other question marks in terms of retention, adherence, the capability of the system to maintain patients over the long course. So all these questions have become to be addressed in a more systemic, organized and structured manner. I would call it under the auspices of the Treatment 2.0 initiative, which is not really a new initiative being brought by the UN system, but rather a framework of opportunity to reflect more comprehensively and try to address virtually all elements that constitute the HIV program at the national level in a systematic manner, trying to identify options, solutions, with very much the backup of new, more accurate and up-to-date normative standards. Unfortunately, we won't be able to discuss too much of the new WHO guidelines. They will be launched in a matter of few weeks, although, as we say, they have become sort of a public secret, because some of at least the highlights have already been shared with a number of audiences. We're going to learn more, but as mentioned, a number of countries have already undertaken this kind of joint review of their national programs, starting with issues on how to revise their testing algorithms, strategies, continuing in reviewing their ARV armamentarium, how to better distribute and reduce perhaps the number of schemes, how to deal with the big problem of stockouts, which points to a weak logistic, fragility of health systems, perhaps under excessive pressure in terms of demands of diversified ARV treatment schemes and regimens. So we have covered already, as a joint effort, quite a sizable number of countries in the region that have begun this joint work, joint reflection. And I must say that it's pretty encouraging because some of the key concepts, some of the fundamentals have been reviewed. We will obviously see some of the impact and the outcomes of this review in the months to come, but it's kind of generating a domino effect so that more and more demand comes to our offices. We do it together in partnership with other actors active on the regional arena of ART services, and we will continue to do so. So I think, once again, the opportunity to take some of these reflections and mix them together with scientific advance is obviously a unique opportunity for the region as a whole to reflect and try to bring as much as possible of the novelties of all these advances in the day-to-day life of programs.